Hello, my name is David Bond. I'm a chiropractor and I've been practicing now for 30 years, maybe longer by the time you see this video. This is my storeroom and I do help doctors acquire some types of equipment, Shockwave being one of them. Now I've used Shockwave for about 2 years here in the office, and I use Shockwave machine that generates the shockwave through compressed air, and the other type is electromagnetic. So when you're looking at those two types. All right, so what can you treat? Why would you want to add Shockwave? Well, if you're thinking of adding Shockwave, the first thing you're going to find out is that you can spend $25,000 for a Shockwave machine. Now, is that practical? No. I'll tell you why. First of all, insurance does not cover Shockwave therapy. If you found some that do, that's the unicorn. So most of them do not cover Shockwave. Is Shockwave effective? Absolutely. What can you treat with Shockwave? I'll tell you what I find in my practice and where there's a big need, a big unmet need. Those things include plantar fasciitis. You're going to find that there are a lot of people out there with plantar fascial pain, foot pain, heel pain, and it's not being addressed. Even Achilles tendon pain. Also, all the bursitis, whether it be bursitis problems, whether it be hip bursitis, trochanteric bursitis, shoulder bursitis. All of those bursitis problems respond very well to shockwave therapy, as does trigger point pain. You also have a lot of people with lateral epicondylitis and medial epicondylitis. Elbow pain is pretty prevalent. Carpal tunnel syndrome kind of falls in there as well. These things respond very well to shockwave. Now, if you're not treating that stuff in your office now, this gives you a great tool to address it. All the shoulder type pain, shoulder injuries, if it's not a complete tear, you can do a lot of good with shockwave therapy. You also have neck pain, back pain, many other problems, even facial pain, TMJ pain, masseter muscle pain. These things do well with shockwave therapy. So, is it worth adding? Absolutely. It's a good tool to add to your practice.
All right, so this is the acupuncture head, or sometimes referred to as the A6 acupoint treatment head. The diameter here is a 6 millimeter diameter, and it's only going to go in about 40 millimeters, 4 centimeters. The energy density is 0.32 millijoules per squared millimeter. So this head is only typically used for treating acupuncture points. And to be honest with you, in my practice, I have never used this because I also do dry needling, and I don't do acupuncture. So I use the needles whenever that's appropriate. But anyway, that's what this head is for, and it's for acupuncture points. The next head we want to talk about is the head that you're going to use for a lot of treatments. This is the D15 Deep Impact, and you can tell the D15 because the surface of the head or the transmitter is flat. There's no divot, and it's also not convex. It's completely flat, and it's a 15 millimeter head, and the depth of penetration is 60 millimeters. The energy density is about 0.63 millijoules per squared millimeter, and what you're going to get here is the scattering of the shock wave upon release of the pressure wave. And what that allows is that deeper tissue can be reached. So this is great for the treatment of deep, painful points. Going to find that you use this one quite a bit. All right, this head is the R15, also referred to as the standard treatment head. Again, it's a 15 millimeter, thus the R15. The effective depth, 40 millimeters, and the energy is 0.38 millijoules per millimeter squared. I use this, and it's recommended for tendonitis, calcific tendonitis, tendon lesions, shoulder calcifications, heel spurs, calcaneal spurs, things like that. Great head for lateral epicondylitis. This is the one you want to pick, and we'll look at the dispersive patterns there on the video, and you can see why this would be a good head for treating tendonitis. All right, so this head is the F15. Again, it's a 15 millimeter diameter head, and it's referred to as the F15 focused lens or the focused treatment head. This will not go as deep. It's about 20 millimeters depth of penetration with a slower energy density. It's at 0.16 millijoules per millimeter squared. So this transmitter will concentrate in that short distance release of 20 millimeters. And this is great for things like TMJ work, masseter muscle, things around the neck, things where you don't want. So the next one we want to talk about is the D20. So the D20 is sometimes called the 20D actor. This does frequency conversion. So the first thing to talk about is the width. This one's a little wider than the last ones we were talking about. This one's 20 millimeters in diameter. The effective depth is 50 millimeters, and it produces 0.48 millijoules per square millimeter. Now, the big difference in this one from the last four is that it produces both shockwave and subsonic waves. This is a great transmitter for deep tissues. So if you're trying to get at the piriformis, the arm muscles, deep arm muscles around the shoulder, biceps, connective tissue to attack and allow repair of fibrotic changes. It's also great for carpal tunnel, treating in the carpal tunnel region. This is one of the ones I use. It's also good for eliminating stiffness and adhesions. So, great tool. The difference on the D20 is that you're also getting subsonic waves. The next one is the D35. It's also the D-Actor 35. This one also produces subsonic waves as well as shockwave. You have 35 millimeter diameter. This is the biggest head we have, the biggest transmitter we have in this set. You get 50 millimeters of penetration, and it produces 0.46 millijoules per millimeter squared. You're going to use this on large areas of muscle. Also great for locating pain points, like in the lumbar spine, across the scapula. You can run this around to find the painful points, and you may want to treat them then, maybe drop down to the D20. But also great for treating deep muscle. Use this one quite a bit with low back cases and also around the scapula.
So let's go over using the machine. And in this case, we're going to treat some lateral epicondylitis as if I'm the patient. All right. So a couple things to go over first. Turning the machine on. When you turn the machine on, you're going to get this screen first, and then you just simply touch it, and that takes you to your protocol screen. You can do this two different ways. You can select the treatment area by region. So if we touch this, we get to just touch on the person that we want to treat. So in this case, we want to treat the arm. We can just touch that. It's already set up and it's ready to go. We can also go to the quick links, and that gives you the primary things that you'll treat in your clinic. So, for example, lateral epicondylitis. I just touch that, settings there, we're ready to go. Now, if you want to set up something that's more specific, you can do that at any time just by simply touching and clicking and setting the perimeters where you want them to be. So once you've selected the perimeters that you want to treat, you're ready to hit start. So we'll go back here and we'll select the elbow for lateral epicondylitis. And there's two different things you can use. You can use an ultrasound transmission gel, or you can use an oil. And there's two different schools of thought on that. Some say that the ultrasound transmission gel causes cavitation prior to the sound wave getting into the skin. And you'll see that sometimes you'll see the gel kind of get emulsified. It'll be white around the edges especially around the edges of the transducer head after you're finished. But between the two, I prefer the ultrasound gel. The oil runs, it doesn't stay where you want it to be. So there is there's a give and take on both sides, but I like this better, and I do heat it before we use it. So at this point here, nothing will happen until we hit the start button. And even from there, nothing happens until you hit the start button on the device right here, or you use the foot pedal. And I like to use the foot pedal because I like to hold the wand like this, and I don't like to have to grip it like this and try to, it's not very easy to work, so I'll use it like this. So primarily what I want to show you here is I'm going to do a little bit of treatment on my arm, but I'm going to turn the pulse pressure down quite a bit because I don't really need any treatment there. So I want to show you the speed that I move this. Now it's very important when you're moving it, and I tell the patient what I'm looking for are painful areas. So when I'm treating around an area, I want the patient to tell me when I'm searching out where the pain is, tell me where that is when I hit something painful, and then I'm going to concentrate on that area. So I'm going to put a little bit of gel on the area that we're going to treat. And I tend to put like a circle of gel, and then I work it around where I want it. And a little bit goes a long way. So when you're ready to treat, you have the gel on. First thing you're going to want to do then is hit the start button, and you'll hear the air compressor kick on. That's the air compressor. And take your wand, put it onto the patient where you're ready to start, and you're going to hit the start button, and you'll hear the machine. It's rather loud. And I'm going to slowly search around until I find those areas that are painful. And then I'm going to slow down a lot. And I'm just barely moving the sound head. And then I'll come back. Then you can stop if you want, come back to the top, and come back down that area. And you'll notice the impulses will be counting down here as you're applying that, that pulse. And that's really how you do it. It's not like this, like an ultrasound head. That's wrong. Okay, you just want to go slowly, go very slow around that area, and you'll oftentimes find the patient tell you and report that after 1 or 2 passes around the area, that the pain is much less than it was prior to the application. Now, I also will tell my patients that if they don't feel any pain, then it's probably not going to help. We almost always have to find a painful area to see a response. That can be different with like busting up fibrotic changes and things like that. Sometimes that's not painful. So a couple things. The protocol that you're picking will suggest a sound head. Here it's the D15, and that's what we're using. And if you want to change any settings, you have to stop the air compressor, and then you can make adjustments. And then start the air compressor and return to treatment. So that's pretty much it. That's how you use it.